Patients with post-traumatic stress disorder often have many concerns upon diagnosis. Patients want to know if this is a curable disease. When considering if this is a curable disease, there are certain things that go into consideration. One stance is to consider that this does not have to be an illness. Upon this realization, the cure would then simply be to build a strong therapeutic alliance, keeping in mind that healing requires the development of skills and capacities such as affect regulation and building up the ability to love oneself. Inherently involved in this alliance would be a combination of properly processing your trauma, therapy techniques, and medication. Processing trauma includes a comprehensive assessment and finally acceptance of your trauma. This can often be very difficult for people to address. For this reason, a patient should actively seek to have a committed provider or therapist on their side. Medication is also an important aspect of treatment. This could be pharmacotherapy or other non-pharmacotherapeutic strategies. Another concern of patients suffering complex post-traumatic stress disorder is how will this affect those around me? Common to being a partner or caretaker of someone with CPTSD is experiencing the caregiver burden. Caregiver burden is a term that is sometimes used to describe the types of difficulties associated with caring for someone with a chronic illness, such as complex post-traumatic stress disorder. Caregiver burden includes the objective difficulties of this work, the financial strain, as well as the subjective problems associated with caregiver demands, the emotional strain. It is not uncommon for the caregiver to develop their own mental health problems as a result of assuming greater responsibility for the aspects of the relationship and the pressure that comes with being a spouse of someone with mental health problems. To avoid this burden, it is important to try to seek treatment together. After figuring out which method of treatment is best for you, it is good to establish a community in which you can grow through the healing process. In Boston, there are resources available that can be utilized so that treatment is not something you go at alone.